AAC Awareness Month. I'm Tiffany, the speech pathologist.
And I'm Emily, I'm the occupational therapist. And we are starting the AAC program here at DMG Children's Rehabilitative Services.
What is AAC? AAC is Augmentative and Alternative Communication. Who would qualify for an AAC device? Anybody who cannot get their wants and needs met verbally is somebody who would be a good candidate for an AAC device. We do offer evaluations and device trainings. For the evaluations, it doesn't matter what prerequisite skills you have. It doesn't matter the motor skills. Emily here is very good at helping figure out access for all of our patients that struggle with motor difficulties. And we even have some really nice devices that can accommodate everybody's needs. I just want to kind of show you some. So some of our patients will use pictures to communicate. They can either say more or stop by pointing to the pictures or handing them to somebody. We also have some mid-tech devices that we can push buttons on this and it will produce verbal output.
Stop. Sometimes this is helpful for some of our patients who need a little bit more support, who are not yet quite ready for a dynamic device like a tablet or a screen, and need some more static information to just push. So this one is called just a low light tech device where we can actually put objects that are attached to some sound chips, and we just wave it over the device. And the device itself will be the voice to speak out what the image was on the card.
We also have devices that can have language apps downloaded to them, and these are kind of more the traditional AAC devices that you're probably used to seeing, but we can communicate and ask for things, talk about things, be social about things using these devices.
These are really great because there's lots of different options that we can consider dependent upon what the patient's needs are. So some of our apps can be structured to be really simple with just a few images to very complex with a lot of different images on them. And
if you have motor difficulties and you're not able to reach and touch the device, we do have other things that we can use.
This is where I kind of tend to play into this a little bit more. We have what are called switches for switch access. So we can connect these switches to a device itself. And then if a person has a difficult time with their motor skills, like using a finger, but they can use their hand or an elbow or their head, they can push this and this will activate the device. We have lots of different options depending on what the motor needs are of the patient. So that's switch access.
And then we also have some really fun ways to access the devices. We also have some devices that use eye gaze. They have cameras in the bottom of them, and you're able to actually just use your eyes and look at the icons and it'll verbally speak for you. Another really cool thing that this device can do is
head tracking. So we just have it a little dot right here on our glasses just for show today. But this little dot is activating the device as well. So if you're not able to use your eyes or control your eyes precisely for the eye access, we can use head tracking. So that is using our head, slight movements in our head to then indicate where we want to speak out on the device.
So happy AAC Awareness Month, everybody, and we would love to give everybody a voice. Please call us if you would like to set up an evaluation, see if your child or a patient qualifies. If you would like to schedule an evaluation for your child or a patient, please call us at 602-470-5532.
Or you can email us at augcomm@dmgaz.org. AUGCOMM@dmgaz.org.